Sarah Ames in a focused respiratory assessment. This is the environment scan. Just kind of scanning just my volunteer. Just to show no notes or anything in the room. Just make sure you can see us clearly. Okay, so as soon as I would walk into a patient's room, as soon as I come in the door, the assessment begins. I'm looking at the patient's color, looking for any cyanosis, any accessory muscle use. I'm checking their posture, making sure that there's no signs of distress or shortness of breath, anything that would alert to me that there's an emergency taking place. And that assessment would continue throughout the focused respiratory assessment. So I'm coming in and Mr. Ames looks fine, so I'm going to go ahead and introduce myself. Hi, Mr. Ames. My name is Sarah. I'm going to be your nurse today.
Hi.
Hi. I'm going to be doing a focused respiratory assessment. Is that okay?
That's fine. Yeah.
Okay. I'm going to ask you a couple of questions before we get started. Do you have a history of smoking?
No.
Okay. Do you have a history of emphysema or asthma? Any illness like that?
No.
Any trauma to the chest or abdomen?
No.
Okay, wonderful. So ideally for a focused respiratory assessment, his shirt would be off. Mr. Ames has opted to keep his shirt on, so we will allow that. I'm going to go ahead and do an inspection. So when I'm inspecting his anterior and posterior thorax, I'm looking for any abnormal colors. I'm looking for any abnormal shapes. I'm checking his symmetry. There's no redness, no bruising. I would be checking the anterior posterior to transverse ratio. I would be checking for any barrel chest, any abnormalities like that. And Mr. Ames is a picture of health. So I'm going to go ahead and move on to the palpation. Mr. Ames, I'm going to use my hands and I'm going to be touching your chest and your back area. I'm looking for any tenderness, any lumps or bumps, any abnormal or asymmetric shapes. I'm also assessing his skin. Can you turn so they can see your back? Thank you. I'm also checking his skin temperature and moisture. Okay, everything feels fine. Okay, Mr. Ames, I'm going to go ahead and check your respirations. While I'm checking his respirations, I am going to hold his radial pulse. Not that I want to trick him, I just don't want him to hyper-focus on his respirations. It kind of gives him something else to focus on. So while I'm doing that, I'm going to watch my watch and count his breaths for a whole minute. So normal respirations would be 12 to 20. Counting respirations of 16 at a normal rhythm. Still no accessory muscle use, symmetric movement of the chest and the trachea. Okay, Mr. Ames, I'm going to go ahead and do something that's called percussion. Can you please face us again? I'm sorry, thank you. Okay, so for percussion, Mr. Ames, I'm going to take a finger on my left hand. I'm going to place it in between your ribs, and I'm going to tap just like that. Okay. It's important to keep all the rest of your fingers up off of the chest. You want to move in a systematic way. Can you turn your back to us, please, sir? Thank you. And can you cross your arms across your chest, and that kind of moves the scapula out of the way. I'm listening to make sure that there's no dullness or hyperresonance, just nice normal sounds. Okay, thank you, Mr. Ames. Can you turn back around for us? I'm going to move on to auscultation. I'm going to be using the diaphragm of my stethoscope. I'm going to be checking for his bronchial vesicular, and vesicular respirations on the anterior and posterior thorax, as well as his lateral here. Mr. Ames, the way that you can help me is to continue to breathe normally in and out through your mouth, okay?
Sure.
I want to make sure to listen to each full breath. Again, moving systematically, picturing the anatomy of the lungs, making sure to listen to each lobe. You lift your arm. Wonderful. Can you turn your back to us, please? Can you cross your arms? And what I'm checking for is clear breath sounds bilaterally. I would make note and report anything that was abnormal, like diminished breath sounds, coarse, crackles, exploratory wheezes, stridor, anything like that. Okay, Mr. Ames, you can turn back around. Oh, actually, I'm sorry. You've been such a good sport. Can you stand up and face this way? I'm gonna go ahead and check his expansion. To do this, I'm gonna have him stand up. Can you sit to the left a little bit? Thank you. I'm gonna take my thumbs and put them together, kind of like a little butterfly right here. Okay, Mr. Ames, can you take a deep breath? Making sure that my hands part equally. One more time. Thank you, sir. Okay, you can have a seat. Okay, do you have any questions for me?
No.
Okay. Any discomforts or concerns you would like me to let the doctor know?
And then I can think of.
All right. Well, this concludes this respiratory assessment. Thank you.